Welcome to PopHealth Week, streaming live on Healthcare Now Radio. I'm Greg Masters, your co-host and executive producer. Flying solo today, Fred is away. PopHealth Week is where the movers and shakers of population health gather. We're all about those real, unfiltered conversations with the people shaping the industry, whether you're a payer, provider, patient, vendor, or of the regulatory community. This is your hub for the freshest strategies and innovations in population health management. Want to stay connected? Head over to popupstudio.productions or shoot me a message on Twitter via @GregMastersMPH, and that's Greg with two G's. You can also reach out to Fred directly on Twitter via @FSGoldstein or visit www.accountablehealthllc.com. Today, we are joined by Susan E. Sheridan, who's earned a Master of International Management, Master of Business Administration, and a new one for me, a DHL, a Doctor of Health Leadership. Sue is a founding member of Patients for Patient Safety, U.S., and the Director of Patient Engagement Emeritus at the Society to Improve Diagnosis in Medicine. Prior to her current roles, Sue served as the Patient and Family Engagement Advisor in the Center for Clinical Standards and Quality at the Centers for Medicare and Medicaid Services, CMS, the Director of Patient Engagement of the Patient-Centered Outcomes Research Institute, PCORI, and led the World Health Organization's, WHO, Patients for Patient Safety Initiative, a program under the WHO Patient Safety Program. Sue is also a member of the Institute of Healthcare Improvement's Lucian Leap Institute and a member of the Future of Health, a global community of leaders whose purpose is to influence, transform, and redesign the future of health. Sue previously spent 10 years in patient advocacy, inspired by adverse family experiences in the healthcare system. Today, we discuss our journey into patient safety activism, which for many of us is rooted in personal tragedy, of which she experienced two major episodes of diagnostic error that changed her life. So, Sue, welcome to Pop Health Week.
Good to be here, Greg.
I'm so delighted. At the very last minute, you were able to do this. So before we get into your story, which is compelling is an understatement, tragic, meaningful, and unfortunately timely for the public at large and me in particular, which I'll explain a little bit. But I was about to put a blog post up. I haven't been blogging for a while, and I wanted to talk about the general patient safety marketplace because I lost my son last June under circumstances I'll describe later. So for the last 15 months, I've just been reeling from depression, disabled by grief, and just trying to put one foot in front of the other and do what I do for a living, because I do still work. But bottom line is I was Googling something and I came up with this documentary, To Err is Human. And I said, yeah, that's the IOM report, 1999, blah, blah, blah. We haven't made much progress, but let me check that out. And I started watching it. I just want to read. This is how it starts. Black screen, fade to, quote, to err is human, but to persist in error is diabolical. And it's tagged Latin proverb. And then it opens up with my guest, Sue Sheridan. So, Sue, with that sort of intro, tell us about Sue and your journey and why you're here today.
Yeah, well, thanks, Greg. And my journey now is 30 years old. And it all started when my son, Cal, was born after normal pregnancy, normal delivery. This was a baby that my late husband, Pat, and I had been hoping for a long time. We even went through some, infertility treatments, and we finally got pregnant. So he was the miracle baby. And Cal was a healthy baby. He became jaundiced soon after birth. I was told that was normal. We were discharged at 33 hours. I wasn't told to look for anything special. I was given a handout saying jaundice was normal. But Cal became really lethargic, like on day 3 after birth. We were at home and I got his behavior changed, and he started to be really sleepy, and he wouldn't wake up to feed. And I called the hospital, and I shared my concerns. In the hospital, the first question they asked me was I a first-time mom? And I was. And they said, Mom, you need to settle down. This is normal that babies are tired. And they said, unwrap him, tickle his feet. And I did, and I still couldn't wake him up. So we took him to the pediatrician. I called the pediatrician. And the pediatrician, when I shared what was happening to Cal, the pediatrician said, Mom, you can come in to my office, but to be honest, I'm more concerned about you than I am your son. So I was getting dismissed as a first-time mom right off the bat. Big red flag, but I didn't know it. So my husband and I packaged up, Cal. We went to the doctor's office. I showed the doctor how I couldn't breastfeed. I showed how he was so lethargic. And the doctor even noted he was so yellow, he was orange. I didn't know that there was a test for this yellow coloring of my son called bilirubin. I didn't know if he had been tested. The doctor didn't reference any kind of test, so he sent us home thinking Cal had an ear infection. And again, not to worry. So we went home, and over the next 12 hours, Cal was just deteriorating and getting more and more floppy, not feeding. So I called the doctor again. He said, be patient, Mom. Don't worry. He gave Cal antibiotics for what he thought was an ear infection. Give it 24 hours. Cal was 4 eyes changing. So we took him to the hospital. He was admitted. And for the first time, he got a bilirubin test, which is a test that costs about $1. And it was one of the highest ever recorded in that hospital. Again, we were told not to worry. So we didn't. And they put Cal in kind of standard treatment for jaundice under bilirubin lights. Very, very common. And the next day, Cal started arching backwards, and his legs were trembling. And he had a high-pitched scream like a cat. And we didn't know, but we were watching our son suffer brain damage before our eyes in a large regional hospital. We reported this behavior. And again, we were told not to worry. We were told that babies did funny things. We were terrified. And so we requested a consult, a neuroconsult. They did an MRI of Cal's brain. We were told that his findings were insignificant. Cal could no longer breastfeed. He postured in these weird, contorted ways that I've never seen a baby do. We were discharged, and we were told we had a well baby. The next 16 months were hell because Cal wasn't developing normally. He could not feed normally. He did not sleep. And as you can imagine, my late husband and I were struggling as new parents. I mean, it was hard in our marriage. It took us 16 months. We took Cal finally out of state to a well-known university, and they immediately diagnosed him with kernicterus, which is brain damage from newborn jaundice. And I was devastated. My husband was so afraid of the news that he wouldn't even go with me. And so I got that news by myself with my son. And the doctor said to me at the university, Mom, have you never seen these documents? And they showed me the MRI results that they did when Cal was 5 days old that clearly showed he had brain damage from newborn jaundice. And that information was never told to us. It was, they failed. I mean, they covered up, it's black and white cover up. And so we had no idea how to manage, a baby with severe disabilities. I felt completely duped by the healthcare system. They never shared with me information that I could have used to protect my baby. No one ever told me that jaundice could cause brain damage. People ignored my concerns. And so that began, like you, Greg, a really severe depression. I was, every piece of me was fractured. But soon after that, I became pregnant with my daughter, Mackenzie, which we call also a miracle. And Mackenzie kind of helped us with hope or, joy. And so we had a little baby with a disability. We had a newborn. And then a year after Mackenzie's birth, my husband started to develop a pain in his neck. And we thought it was stress, of course. We went to local doctors. They finally did an MRI of his neck, and it was found that he had a mass in his neck. So we went to the best hospital in the United States for that kind of problem, which was in Arizona. And they did surgery on Pat, and they removed the tumor. We were told it was benign. So, yay, we went home. I was an informed patient by then, so I collected all the documents. I got the documents that said it was a benign tumor from the doctor, and we were happy. 6 months later, my late husband, the pain returned. It was confusing. We're like, how could this be? So we went back to our local doctor. They discovered that the mass had returned to Pat's neck. It was the size of the fist of the surgeon, because we immediately went back to Arizona. They removed it. We were told that the benign tumor became malignant. And that was really confusing to me. And so I started asking doctors all these questions while Pat was recovering. And I said, how did a benign tumor become malignant? And they were asking me, why didn't we get treatment at the first surgery? And I said, because it was benign. Well, all these doctors came through Pat's room saying, why didn't he get treatment after the first surgery? And we're like, well, it was benign. And I went, wait a second. I want to see his first pathology. No one would show it to me. So I went down to medical records. I signed out my husband's medical records. And I learned that although they told us it was benign, 23 days later, after we were discharged, a final pathology was done as a malignant high-grade synovial cell sarcoma. And that report never made it to the neurosurgeon or to us. And Pat fought during that time. It metastasized through his spinal canal, and they couldn't save his life.
Clearly, that was a communications handoff fumble big time.
Big time.
Was the first path report calling it benign, but updated by the follow-up path report, or were they both?
That's right. The first pathology was only called an atypical spindle cell neoplasm. And it did say in the doctor's report that pending final test results.
Okay.
And so the final path, the neurosurgeon believed that meant benign. He didn't understand what atypical spindle cell neoplasm meant. He thought that was, so there was a huge, in every way, there was a communication breakdown. And then when they had ordered more stains, the pathology, and the neurosurgeon didn't know that. We didn't know that. And so when they issued the final pathology, no, it wasn't on anybody's radar. I even spoke to the pathologist saying, when you got this final pathology, why didn't you pick up the phone and call the doctor? And his response was, that's not my job.
Just tuning in, we're here with Susan E. Sheridan, a founding member of Patients for Patient Safety, U.S., and the Director of Patient Engagement Emeritus at the Society to Improve Diagnosis in Medicine. Stick around, you won't want to miss the rest of the story.
Right. I've heard that before. Definitely part of my theme and narrative, if you will. But
yeah. So
you got answers in an academic setting, delayed as they were, unfortunately, on Cal.
Yes.
Did you access the delivery system initially in a urban, suburban, or rural hospital? What was the setting? You don't have to name the facility, but
yeah.
What demography? Characterize the demography that you were in. Were there available competent resources?
Absolutely. And matter of fact, in Cal's case, when we learned we were expecting a baby, we lived up in the mountains in Idaho. There was a small rural hospital here, but we chose to be safe. We go to the large regional hospital
right.
in our city. Little did we know that we compromised safety by doing that. They had a level 3 NICU. They had, children's hospital. They had everything. And Cal slipped through every step of the way.
And we, as public, invest our faith in that stamp of approval, if you will.
Absolutely.
Public trust. we gravitate towards a level 1 trauma center, a level 3 NICU,
Right.
Yeah. And so
Right.
what else can we do?
I know, and as parents, we thought we were doing the right thing.
Right.
And, Greg, you talked about guilt.
Yeah.
It's like, oh man, we live with all these what ifs. What if we just had the baby up here at the little rural hospital?
Right.
We think he probably would have had a better outcome.
Right.
Yeah.
And such in retrospect, really a simple procedure oversight.
Yeah.
Caused the downstream consequences that you've lived with now for a long time. Yeah.
Exactly.
Wow. So, and then, Pat situation only adds to that wound.
Oh, absolutely. Once again, we thought we were doing the right thing by going to the global center for neurosurgery
in
Arizona. We learned that kings from Saudi Arabia, athletes all go there.
Right.
And so we had, we were absolutely certain.
So it's considered a center of excellence.
Right. Right. And the surgery was excellent, but the system completely collapsed on us.
That handoff. Yeah.
That handoff. There was just it completely fell through the cracks. Top-notch pathologists, top-notch neurosurgeons, but there was a link.
And place this in the timeline for me, Sue.
Say that again.
Pat's situation.
Oh, Pat's situation started 4 years after Cal was born.
Cal.
Yeah. Yeah.
So this predated the meaningful use of electronic health records.
Yes.
So not that that's any kind of rationalization, but
right.
Today, even with this so-called hardwired electronic health records framework we have out there, these handoffs, failed handoffs are still very present in the system. So
they are.
It's not that they've cured that problem necessarily.
I think open notes and the meaningful use is helpful. I think it's empowered us, to access our portals.
Right.
But it hasn't fixed the system. It's made us more empowered and maybe a little more weary. So we check things and that's good because we can catch things. But the whole systems piece of it, there's a lot of improvement to do there.
Yeah. Now this is where the activism comes in, right? Mischaracterize your involvement as advocacy. It's activism. It's doing something. So let's pivot to this is the cause for you to do what you're doing now. Talk about the launch of Patients for Patient Safety and the community it's developed and the prongs it has out there to grab attention and create some meaningful movement towards reform, whether it's legislation or otherwise.
Right. Well, like I mentioned, I've been an activist for 30 years. And during that journey, I helped change some protocols about newborn, standards of care in newborn jaundice. I actually worked for the federal government in patient safety. I worked in research institutes. I spent time at WHO, where there was a lot of energy around patient safety. I saw it happening in the early the 2000s. Then I saw it falling off the radar, and that scared me. So I originally I retired for a year, and but during all that time, I met these incredible activists like you and me, Greg, and I work with very good healthcare providers, leaders in the healthcare systems. And so when I saw patient safety falling off the radar in 2019, 2020, around COVID, I called my colleagues and all who have, just like you and me, Greg, lost family members or themselves have been harmed, or other really big leaders. And we decided to meet in the mountains of Idaho. And we met in the mountains of Idaho for 4 days. We strategized, we wrote plans, we envisioned ourselves, we cooked, we drank, we danced, we cried, we lit candles, we went out on the lake, and we decided together we were going to re-energize patient safety. And we have. And we started, that was 3.5 years ago. And since then, we have, really ramped up on advocacy, public comment, on presentations, on publications, on research. on really bringing the patient voice to Capitol Hill, on, letting the healthcare system know and the leaders who we know that we expect more and we deserve more. And so we've got now over 150 of people like you and me, Greg. We've got clinicians, nurses, healthcare systems joining us, who we all in spirit believe collectively we need to raise the bar on patient safety. And the status quo no longer is acceptable. And so that's, Patients for Patient Safety US. We are a patient-led organization. We are under the umbrella of the WHO's Global Patients for Patient Safety program. And there are chapters all over the world. And I had the honor of helping start that in 2005 with the WHO, as well as other leaders at Patients for Patient Safety US, like Marty Hatley and others. So we are ramping up not only in the United States, but globally as well. And really, I would say partnering with the healthcare leaders, systems like CMS, HRQ, CDC, but we're partnering, but we're also getting a little pushier, let me say, because we some of us asked ourselves if we've been too nice over the last 20 years. And so we are really trying to raise the bar and let our leaders know that we expect more.
Good trouble, if you will, right?
Yeah.
Stir it up. Right?
Yeah.
So, okay, wonderful. And apparently you have an event coming up here rather soon. We're recording on the 3rd of September, and you have an event coming up in DC. Tell us about that.
That's right. Well, in DC, and this is really exciting. First of all, the WHO every year has the World Patient Safety Day. So they celebrate patient safety in different themes. This year, it is diagnostic errors. So both my son and my husband experience diagnostic errors, as do what is estimated up to 800,000 people a year either die or are disabled by diagnostic errors. So this year we're going to DC. We're having a whole series of events. We're kicking off with a dinner in DC. We're launching a project called Project Pivot, where we're bringing all these patients and patient groups together. And Greg, you're invited. We're going to be talking about redesigning those patient surveys that we answer after we go to a hospital. They're not asking us about the real stuff. They're not asking us about patient safety, discrimination, diagnostic errors. So we're getting together to help rethink that survey. So we're doing that. And then we're going to the Hill, advocating to our elected officials about patient safety, about reporting patient safety. Right now, reporting patient safety events is voluntary at the hospital level. So we're calling for a patient reporting system. We're calling for non-payment when there's harm. We don't think we should be paying for it, and we don't think the hospitals should get paid for it. And so we're calling for non-payment. We're calling for consequences when hospitals cover up, like happened to both Cal and Pat and many, many others. So we have, an advocacy list of asks. So we're going to the Hill. Then we're doing a march to remember those who have passed, those who have been harmed. So we're marching from to the Capitol, where we'll be all planting flags with our loved ones' names. We'll have it's a very powerful time where we all share and remember our loved ones, and we plant flags in the front of the Capitol with their names. And then we go back to what we're calling a leadership summit or a leadership briefing. We go back to Johns Hopkins, where all this is taking place. And we have distinguished leaders from our healthcare system, from Health and Human Services, from our government, sharing, what's next, what's going to happen going forward in patient safety. So there's all these events happening the 15th, 16th, and 17th. And we encourage all people to come, plant your flag, march with us, come to our events. We're also going to be watching a film called The Pitch by Mike Eisenberg. That is about, technology in healthcare, which is really, really kind of the frontier of keeping us safe. So those are the events, and events like ours are going to be happening all over the world.
Yeah, I'm attending, and I'm thrilled. The three tiers, the activism on the Hill, the flag, the remembering, the grieving, and then just the connecting with like-minded people who are active in the space. I am bing, 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 totally stoked by that and look forward to it. It's going to be a fun event.
It is.
I was thinking, oh, by the way, I want to say shout out to WHO. They've been hammered a lot.
Yes.
They're an easy target in this crossfire between science and pseudoscience. I'll give them the benefit of the doubt. So WHO takes a hit, but you know what? They're well-intended, competent people.
They are. And, hats off to them for really elevating the patients. They really believe that the patient voice is integral in driving safety.
Yeah, absolutely.
And so hats off to them. Not everybody agrees with that. Yeah.
And so much talk about patient-centered care. It's few walk the talk. You see it in ad copy everywhere, but when it comes down to the root culture enabling that 360 perspective, you never hear, not my job.
Right.
Never.
Exactly.
A complete violation of the Hippocratic Oath.
I agree.
And unfortunately, this is where policy and practice collide, because policy influences the business models. The business models shape the behavior, and the behavior is what drives the outcomes.
That's
some of which we don't want and should be never events. Anyway, Sue, we're reaching that point to wrap it up. I am delighted to have met you. How do people get in touch with you?
You can find me on our website. Our website is www.pfps.us. Sue Sheridan. My email is ssheridan@pfps.us. You can find me on LinkedIn, although I'm not great on social media, but I'm there. And go to our website. We've got a great website. It tells our story, has the faces of all of us, Greg, and shows our priorities in our actions.
I will, again, gratefully participate. I consider it a privilege. So, Sue, thank you. I'm so sorry that your story brought you to this mission in life, but thank God you're doing what you're doing, and I'm privileged to have met you.
Thank you, Greg. It's an honor, and we will be doing it together, right?
Sounds good to me.
Okay.
Thanks, Sue.
And that's a wrap for today, folks. A big shout out to our global audience for tuning in, and a special thank you to Susan Sheridan, a founding member of Patients for Patient Safety, PFPS US, and the Director of Patient Engagement Emeritus at the Society to Improve Diagnosis in Medicine. Follow Sue's work at www.pfps.org and on Twitter via @PFPS_US. If Pop Health Week resonates with you, we'd love your support. Give us a thumbs up on your favorite podcast platform. Share it with your network. And don't forget to subscribe so you never miss an episode. Remember, we're live on Healthcare Now Radio every weekday at 5:30 a.m., 1:30 p.m., and 6:30 p.m. Eastern. And for you West Coasters, that's 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. On behalf of Fred Goldstein, Healthcare Now Radio, and myself, stay safe, stay tuned, and we'll catch you in the next time.